And we're back with Dr. Richard Gibney. He's retired, but never far away from the kidney community. So, Dr. Gibney, tell me a little bit about your latest endeavor, which is the governor's chronic kidney disease task force. I believe we are calling it the Texas Chronic Kidney Disease Task Force, right?
Yes, and it's an exciting program. The opportunity, and certainly with the pandemic and with what happened with George Floyd, there's a great urgency to do big changes to make things better. So it's opportunity on how do we make things better. So with this, the 5 areas that we're going to work on are legislative things that make things easier for the people of Texas, transplant, dialysis, CKD, meaning chronic kidney disease, where there's a mild or moderate decrease of function, where you see somebody as an outpatient, and then also education. How does that fit into this whole story to make this work? And so it's a huge opportunity.
And prevention.
Correct.
Right.
Absolutely. How do we stabilize and slow down the loss of kidney function? So right. Our goal, and again, the governor was very clear. 2 things he'd like is, number 1, he'd like you to dramatically improve health care and the quality of life for the people of Texas.
In a cost-effective manner.
Correct. And with decreased costs. Mm-hmm. And again,
exactly.
And at the same time that's happening, a significant improvement in the patient experience.
Exactly. And all of that can be done with patient empowerment, with engaging patients in the process. You don't want to have what we have today, which is our little broken healthcare system that needs some help. Our job is to come in and help everybody across the spectrum. I believe we have some of the best providers in the country. Our doctors and nurses and staff love and care for the patients that are in their practices. They're just in a system that is antiquated and needs some assistance in order to help them do their jobs better and help the patients have a better experience. Everybody's kind of it's the system itself that needs to be recalibrated.
And that's really the nice part of the story, because you're absolutely right. The doctors, the nurses, the technicians, everybody in the system break their backs every day, work hard,
that's right.
Try everything they can, especially with the coronavirus right now. So everybody's working hard, and they always do that to try to help people.
And we're seeing that. I'm so glad that the public sees that and gets to see that the reality is that you have these wonderful people who have dedicated their lives and have a calling or a mission, if you will, called healthcare. They just are in a system that is broken. But they are not. They are good. They are doing what's right. We just need to give them tools so that they can be productive in what they're doing.
And you're absolutely correct that the system forever has been the wrong system, because we've always said, well, we'll do everything for you and we'll leave you out of the solution. And it's clear that if the person or patient or person is involved, that has the problem, is involved in the solution, things are to get better. And that's what we did, is we simply went from a assembly line approach in the dialysis unit where everybody got the same treatment and they really didn't have any involvement. They just came in, sat down, did nothing for 4 hours, and then went home, to a empowered approach where we said, how would you like control? How would you like to be involved in your care? How would you like to be involved in the solution where you have a better quality of life, you get a dramatic improvement and drop in hospitalization rate, drop in mortality, and this whole place becomes joyful, this whole place becomes sharing and in a partnership way, and the patients just grabbed it. And the best judge of this whole story, we had 70% when I retired to go around and give talks about the empowered and and self-care in center, but also empowering CKD story, 70% of our patients were doing empowered dialysis after 4 years, and we started with 0. And the big numbers, which the patients are smart, they're bright, they're talented. They look at it and you say, here's your data. Your hospitalization rate fell in half. Your mortality fell in half. And you think,
Wow.
do you think if the patient's involved in his care, that the patients do better? And everybody goes say, well, of course. Well, we need to involve the patients in the solution.
Exactly.
And if we do, big things happen.
And we're seeing that shift because the National Institute of Health is involving patients in their studies, in their clinical, not just in clinical trials, but in the actual panels where they're deciding, okay, what questions are we going to ask physicians? How are we going to conduct this study? They're bringing patients in at the beginning and not just at the end as a part of a clinical trial.
And a good example is in the CKD, or the chronic kidney disease, where you could have a small amount or a medium or a severe amount of decrease in function. And our job is to figure out how can we stabilize or slow down the loss of function to avoid dialysis, and so you don't need some kind of replacement therapy. And our goal is very, very, I guess you'd call it bold and ambitious. We'd like to get to a point where nobody goes on dialysis again, that we're able to preserve function. And we'll see that, A, by getting the patient more involved, giving them more tools to have solutions by, again, it gets back to the word you use, system. We change the system to be unique for every person, not just one system for everybody, and think, well, how come these guys didn't do very well? Well, that didn't work for them. We'll change it to something else. And that's what we've done. The second thing is there are a lot of new drugs coming on the market. There's a drug called SGLT2 inhibitors. And it's a diabetic drug and has both cardiac and renal benefit to stabilize kidney function. And there are many more drugs like this that will be coming on market. And so with the addition of new drugs, there's another drug set that will be on the market within 2 or 3 years that shuts off the inflammatory or the scarring process, that whatever thing's going on with your kidney, this stops the inflammation to scar and again stabilizes function. So one day we can say nobody goes on dialysis anymore. It's historical, and during the time it was needed, it was great, but we don't do that anymore. That's coming.
Wow, that will be an exciting moment. I can see it coming too, because we have doctors like Dr. Bill Fussell, who has invented an artificial kidney. And I know, like, from talking to him, that his work is, it's moving down the line. Like, he's 5 years from bringing it to the general public, and probably 2 or 3 years from real substantial clinical trials.
The other important thing is the options of care. And it shouldn't surprise you that what happens is, let's say you come to see me and you have, let's say, mild decrease of function. And so mild to moderate. And so we need to talk about options. Well, I sit there and I say, well, we could do transplant, or we could do home therapy, or we could do in-center self-care. But we're still going to work very hard to stabilize and slow down your loss of function. But the problem is that you are going through the grief response because you're sad, because you don't want to be on dialysis. You don't want to have a transplant. You'd like to be healthy and well. And so when I tell you this story, it may go right by you. And I said, well, I told her that story, but you couldn't hear the story because you were so sad or upset about your medical problem. So our job is to continuously tell you the story and then to tailor it for you, that what would work for you. And everybody's different. All people are unique. And so we have to tailor it. And so if we do that with great intensity of what's important to you, we also have to find that out and say, who are you as a person? who are you? Because big difference. If you're a 88-year-old farmer in Hillsboro, Texas, and you run your own cattle and you harvest your own corn and your wheat, you're a capable man. I mean, I couldn't do that. So you put him in a dialysis unit where it's sit down, be quiet, don't touch anything. He'll be miserable, awful.
Oh,
So
yeah.
we took him and we trained him for home dialysis because he didn't want that treatment to interfere with running the cattle or what he did with his wheat and corn when he had to harvest or plant. So that's why everybody's unique. You'd say, well, if he's 88 years old, you know, how much power do people have? And then you have to adjust it for people and find what works best for them.
And that's exactly right, Dr. Gibney. In our next segment, we're going to have Dr. Gibney come back and talk to us about empowered CKD. And let's hear what he's done to empower the CKD patient, a little bit different from the end-stage renal disease patient. So if you have diabetes, hypertension, or a history of chronic kidney disease in your family, you're going to want to come back and listen and pay close attention to what your options are, because the world is opening up for us. I know we're going through COVID-19, but kidney disease is experiencing a transformation. And Dr. Gibney is a part of that. So come back, listen, and learn something new about chronic kidney disease.